symptoms related to the damage of the lower esophageal mucosa due to the reflux of gastric contents. Specifically, we are talking about the acids and pepsin, which can produce symptoms, mainly heartburn, or what is called medically pyrosis. And in addition to the symptoms, there will be very important and serious sometimes damage to the mucosa of the lower esophagus, because the mucosa of the lower esophagus is not prepared to be in touch with the acid and pepsin. So the reflux of the acid content will lead to or may lead to inflammation of the lower esophagus, called as reflux esophagitis, or it may lead to other complications including erosive esophagitis, or even stricture with long time of touch between the acid and the esophagus. And most important is the metaplasia of the lower esophagus, especially leading to what is called Barrett's esophagus. Barrett's esophagus is metaplagic changes of the mucosa from the stratified squamous epithelium to columnar epithelium, and unfortunately this metaplagic changes is precancerous. That's why adenocarcinoma of the esophagus is more common in patients with this disease, with gastroesophageal reflux disease. The cause of this reflux is either due to defect in the lower esophageal sphincter pressure, which allow the return back of the acid, and this is seen with spontaneous transient relaxation of the lower esophageal sphincter. Also, the disease may be associated with a transient increase in the intra-abdominal pressure. That's why this disease transiently is common in pregnant ladies due to the increase of the intra-abdominal pressure, or due to atonic lower esophageal sphincter, loss of the tone and function of the lower esophageal sphincter. It was thought that hiatal hernia or hiatus hernia, whatever the term, as a cause for this condition was very commonly used, but this condition is a rare condition. Hiatus hernia or hiatal hernia, which is blamed for many of these diseases previously, many cases of this disease, but this condition is a very rare condition. This is first, and if it is found, it is not a direct cause. It is not a direct cause. It can disturb the function of the esophagus, the function of the lower esophageal sphincter, but it is not a direct cause for the gastroesophageal reflux disease. Other problems associated with this disease is the prolonged acid clearance from the esophagus, has been noticed, and delayed gastric emptying, dysfunction of the stomach, which allow for the gastric content to remain for a long time in the stomach and give more chance to return back into the esophagus, and the defect in the mucosal resistance of the esophagus. What is the clinical presentation of this condition? This condition is a common condition, and the main symptom related to this condition is the heartburn, and this classically described as substernal sensation of warmth or burning that may be radiated to the neck, and it is on and off. So sometimes the symptom is going to increase, and sometimes the symptom is going to disappear or become milder. The symptom is aggravated by some activities such as the recombinant position. لما الواحد يتمدد يصير عنده أكثر, bending over, and eating high-fat meal, because the high-fat meal lead to relaxation of the, decrease the pressure of the lower esophageal sphincter. Other symptoms include belching and regurgitation. This is the typical symptoms. However, the condition may be presented with atypical symptoms related to the upper part of the GIT and maybe even the respiratory system. If the acid is going up to the pharynx, this may lead to pharyngitis, lead to hoarseness of the voice, and even non-allergic asthma, and dental erosions and chest pain, which may mimic angina pectoris. If the disease is inadequately treated, then there may be complications, and I mentioned already these complications, which include erosive esophagitis or fibrosis with stricture of the esophagus, which leading to dysphagia and some other problems, and the extreme is what's called Barrett's esophagus with metaplasia and maybe adenocarcinoma of the esophagus. What is the treatment of this disease? We can put this disease into 3 steps, and we can step up the treatment according to the severity of the condition. Or sometimes we do the opposite. We give the maximum treatment and then we step down until they get the optimum treatment of the patient with least disadvantages of the treatment, such as the side effects and so on. However, the aim of the treatment is to decrease the acidity of the oxide, and this is, of course, can be done by H2 antagonists and PPI, proton pump inhibitors, to decrease the gastric volume, and this can be done also by these drugs, in addition by what is called prokinetic drugs, or drugs with prokinetic effects, such as metoclopramide, the very well known antiemetic drug,